Hi, this is Dr. Jordan from Pinnacle Chiropractic, your pediatric and prenatal chiropractor in the Sarasota-Bradenton area. And today I am here to talk to you about dysautonomia. And so this condition is something that many doctors don't talk about. They might not know about it, and they definitely don't associate so many of the conditions that we see to being linked to that. And so this dysautonomia can affect so many regions of the body, so many systems of the body, anywhere from your gut issues to immune function, all the way to emotions and behavior. It's all controlled by your autonomic nervous system. And so if there's a dysfunction in that autonomic nervous system and how it is able to regulate your body, you're going to have issues and see things through all of your systems that are kind of linked together by this condition, but it's not something that anybody really talks about. So no matter how many specialists you're seeing or doctors you're seeing, no matter how many tests have been run, imaging has been done, it's just not something that is ever really talked about or explained or given any answers to, because not many doctors have an answer for it. It's just something that they give you a title for if they do that, and that's about it. So I myself have had some personal experience with dysautonomia. If you saw my testimonial yesterday, you kind of read about that. So when I was younger, I fainted all of the time. I had other struggles. I definitely would say I didn't have the healthiest immune system. Definitely now looking back, had gut issues as well, but the fainting was the biggest thing I could say as a child I remember having struggles with. And so I would faint if I got too hot, which would mean if I was somewhere inside bundled up, or if I got overheated outside. I would faint if I changed positions from sitting to standing or vice versa. Primarily that would happen in church a lot. I would faint if the air was more stale and not enough circulation, so nursing homes I would faint. And if I was donating blood, I could see my own blood flow, but seeing somebody else's blood flow really affected and was a trigger for me, so that would cause me to faint. It was embarrassing more than anything else. I really wasn't that concerned about it until I fainted when I was 17 years old. I fainted after I was riding my horse, so I rode at a barn about an hour from my house, and I was riding in the middle of the hot summer day, having a great ride, went from being seated on the horse, to jumping off standing, and immediately knew that I was going to faint. My blood pressure dropped. I knew that I was going to faint, and you're not supposed to fight it, but I had this 1,000-pound animal that I couldn't just let go, so I managed to get him into a stall, and as soon as I did that, I hit the ground so hard, and because of how hard I hit the ground, I actually had a seizure on top of just fainting as well. So as soon as I woke up from that little mini seizure, I felt completely fine. Everyone at the barn was very freaked out, but I drove the hour back to my house. My parents were, of course, appalled, so they drove me right back to the ER, and I had so many tests done. Tests at the ER that day, and then probably 6 to 8 months of tests and follow-ups after that. I remember I met with a cardiologist and a neurologist, of course, like a general doctor, and then I had a lot of testing done, from EKGs to stress tests to a turntable test to a sleep study, lots of things. And they basically only came back with the fact that I had vasovagal syncope and maybe mentioned the word dysautonomia once, but that was the term I was given. It's more of a condition than a disease is what they said, and so there was nothing I could do about it. One of the doctors said one of the only things that had worked for other patients was taking a tablet of salt in the morning to regulate my blood pressure, to basically increase the viscosity so my blood pressure couldn't drop so quickly, and drinking a Gatorade a day. So now at this point, I think I was coming out of my first year of college. Hadn't fainted at that point, but was going to start working as an exterminator for the summer. So I was outside all day in the heat, and of course in my head the doctors told me to take a tablet of salt in the morning and a Gatorade a day. And so that is what I did, and by the end of the summer I went to my dentist. I had never had a cavity in my life. I was 17 years old, 18 at that point, and had 12 cavities. So needless to say, it wasn't the healthiest advice I could have been given, and I realized quickly that the medical advice probably, there was something more. I was kind of seeking else, what can I do, because I still felt like I could get overheated. I didn't want to have a seizure again. I was kind of scared of what if, and so I just was looking for other answers. That summer then, of course, I was back home and was going to my chiropractor, and explained everything to him. And he explained how the nervous system works, how your vagus nerve works, how basically every symptom of the body, the variety of symptoms that can happen from fatigue to lightheadedness that I was definitely getting. The dizziness I was getting all of the time, fainting, anxiety, headaches, gut issues, immune system challenges, the list goes on, is all related back to that autonomic nervous system. And if there's an imbalance in how that nervous system works, it is going to cause those areas in your body to not communicate, to not be able to work together, and to kind of go awry. And so my fainting, which is my body basically saying, like, you need to pay attention to me, something is off, something is not right, and I was pretty much ignoring it for so long. So after getting that explained to me, getting more adjustments, really following up on that when I went to school, I have actually not fainted since that first summer. So of course the chiropractic lifestyle also has shifted my health a little bit, just in knowing about things that are healthier for me. Obviously, I do not drink Gatorade since that summer. Haven't had a single one. Definitely know more about electrolytes now and how your body is supposed to intake natural things and how salt can be good for you, but specific types of salt and all. There's just a whole rabbit hole of that. But the blanket advice I was given was just not enough at that time. So I had to keep digging. So that basically your dysautonomia, your autonomic nervous system, is related to so much of a stressed or overactive sympathetic nervous system, which is that fight or flight. So my body was basically telling me that I was overstressed, overworked, needed to put that brake pedal on, get myself back to a state of health and rest and ease, and I wasn't listening to it. So basically dysautonomia is really your body showing you that there's an imbalance. And how do we fix that? What do we do when we see teenagers, mostly, because most people don't get diagnosed with dysautonomia until they're into their teens, or mostly as adults. So when we see teens in our office that are coming in with sleep struggles, they're coming in with immune challenges, coming with gut issues, they can't digest food properly, they're having eczema, they're having acne, they're having a plethora of issues. Almost always headaches, almost always menstrual problems. Our first thought, of course, is that dysautonomia, that there is something going on in that autonomic nervous system. The vagus nerve is not able to fire correctly. And so as chiropractors, it's really our job to fix that. And so if you know anybody that has a child that sounds like they're struggling with some of these things as a teen, it's an amazing time to get that nervous system figured out. If you know somebody who has children that even as a child they're seeing gut issues, immune issues, behavioral issues, that's the start of that nervous system being out of whack and not being able to regulate itself. So if you know anyone who, you can look at a kid, a teen, and see that there's a plethora of issues going on, it's not one thing. They've been to numerous doctors, they've had all of the testing, and it's just not getting them the answers that they know that they need. Chiropractic care, and specifically subluxation-based chiropractic care, is probably the answer for them. So you can look at the reviews for our office, our testimonials. Almost every patient is going to experience benefits with sleeping, digestion, headaches, hormones, immune system. The list really goes on. And if you are not local, there is an amazing website called pxdocs.com, and you can go there to learn about more of the research behind this. They have full articles on that site, and they also have a directory of other doctors that are certified in this type of work from all over the US. So if you are interested, please share this video, send it to someone you know, comment any questions. We always have workshops coming up where you can come and learn more. And I hope you have a great day.